So after we sort of ask about and acknowledge the losses in chronic pain, important to also provide some key messages about grief. So just sharing with our clients that grief is a normal response to loss, that there is no right way to grieve. Although two people with chronic pain may experience similar losses, their grief responses might be very different. Grief does not have a timeline. And one of the most important things is that the goal of discussing grief or providing grief interventions is not to get over the grief or go back or rebound to your old life, but rather integrating the loss into a new life that incorporates these experiences with loss and grief. Now, one thing I'd like to highlight is that with the third point here, that no two people kind of experience grief the same way. Something that's coming up increasingly in my practice at the Chronic Pain Center is the experience of young adults and or emerging adults who have chronic pain. So I think the healthcare community, certainly the scientific community, is realizing that, we have a children's hospital, we have pediatric pain programs, we have adult pain programs, but there's this middle group of emerging or young adults who, when they experience chronic pain, may experience their own unique set of losses. So an example comes to mind where a young person was sitting in one of our pain coping CBT groups, was looking around at all the middle-aged and older adults around them and reflected back, these other people, these other participants are talking about all the losses of the way things used to be. I used to be able to do this. I used to be able to do that. Whereas this person's losses were really around potential and the loss of a future life. And I thought that was a very interesting reflection, and maybe just something for us healthcare providers to be more aware of, that for this special group of emerging adults, there may be some unique types of grief and loss.